Ooh, hey guys, hey, it's Tess Washington, and welcome back to Test MD TV. How you guys doing on a Monday night, 6 p.m. Pacific time? We right on time, guys. Let me tell you, this kind of like becomes kind of routine, but this is a lot of work. Let me stop. I'm Tess Washington, board certified physician surgeon. And on this channel, every Monday night, we focus on the optimization of your looks. Take two. Your looks, love. I don't even know. What a day! What a day! Um, uh, I forgot what we focus on. Anyway, we just come back every Monday night because I'm not going to redo that part. So we focus on your looks, love, wealth, and health. I think that's the way it goes. It's been a long night. I had to admit. I had to admit. Bad doctor. Bad doctor. I haven't been asleep because we have had so much going on. But tonight we're talking about looks and we're going to talk about wrinkles. And do you really have to get injectables in order to not have wrinkles? That's the main topic at hand. I'll leave all that other stuff for later on in the show. But what I do want to say is if you like this kind of content, feel free to subscribe. Come on back, tell a friend, push the button, become part of the family. Trust me, we have a lot of fun. All right, so let's get into the content. So basically, hey, what's going on? How's it going? Oh, okay, all right. Oh, yeah, yeah. Well, listen. Okay, so I'm glad that you came on screen. Right now, we're going to talk about wrinkles. That's the whole purpose of the show. But Jacob just brought up something that we're just going to go ahead and elaborate upon. We do have a virtual practice, and I'm licensed in 6 states currently, those states being Illinois, Indiana, Montana, New York, Nevada, and California. However, Texas is one of the licenses that we are working on right now. So we have four of the licenses that are kind of like in the brewing: Texas, Georgia, Arizona, and Florida. So, by him making that statement, I'm offering 15-minute free consultations on the different topics that we focus on: hormones, skin, nutrition, um, weight management. We do medicated weight management. Also, we do transgender hormone enhancement, STD, just a lot of stuff, just a lot of stuff. If you want more information on what we do with the virtual practice, click the link in the bio and we'll send you a list of the services we have available. We are open 24/7. So when Jacob mentioned that, he was just saying, hey, I'm in Texas. And for so basically, I'm still going to give you your consultation, Jacob, but it will be of a different realm. In other words, it would be kind of like general conversation. I wouldn't be able to prescribe him anything or give any specific medical advice because I'm not licensed in that state. Now, with that being said, secondary towards being in the middle of a pandemic, there are there's some laxity in some of the laws as far as where a telemedicine physician can practice. However, with it being this is an aesthetic situation, and I want to be able to hold your hand. I don't want to just like start you out and be like, okay, you're your own, take care. I don't think that that is effective. I don't think it's fair. It's not providing the patients any kind of continuity. So before I would start treating Jacob, I would like for my Texas license to be clear. Now, with that being said, let's say, Jacob, that you lived or you were born in Texas, but you just happen to be visiting in Nevada or one of the places that I'm licensed. We are responsible for you in the state that you are currently in during the examination. So if you while we're waiting for Texas to come through, which licenses have been coming through a little bit quicker, secondary to the pandemic, but if it takes a little bit too long, just maybe go to one another, say some license. Go hang out with a relative and then we'll take care of you once you get situated. But outside of that, I will definitely provide a lot of content based upon what you mentioned to me to be your area of concern, because it's actually an area of concern that a lot of people have. So we'll address that for you. Okay. All right, guys. So let's get to the nitty gritty. Botox. First of all, what is Botox? And why should you stick around to the end? During this course of the segment, I would like to share with you guys various ways that you can decrease the signs of facial aging, aka wrinkles, without Botox. I'm not going to say 100% without, because we live in a time of immediate gratification. Hey, we want to take a pill? Boop, am I skinny yet? I mean, that's how we think. That's how our world is set up. And Botox does give you that whoop. Now you see it, now you don't. So, with it being that we do live in a microwave era, I'm not even going to go as far as to say without Botox. And I don't have a problem with Botox. I use Botox, it's how I make my living. However, if people want to more so have like various options, or what could I do in between botulinum toxins so that I can make my results last a little bit longer, so that I don't have to get injected as frequently, that's what I hope to share with you. And not just facial wrinkles, we got skin all over our body. If our face is wrinkled, our knees and our elbows and our toes and everything else is going to be wrinkled. Let's talk about skin preservation as we go through the aging process. How about that for a topic, right? Okay, so first of all, let's start with botulinum toxin. What is it? So basically, let me just share the screen with you here, show you guys something. So basically, Botox was first started with these doctors, Mr. and Mrs. Carruthers, and the way that they actually stumbled on the magnificent gift of Botox being able to reduce wrinkles is they were trying to inject it because the person has strabismus. So it was first used in 1983, and it was basically initially called oculinum toxin, ocular and oculinum, okay? Because strabismus is when your eye just kind of like goes kind of like, in that area. So when they injected the oculinum toxin to correct the strabismus, they noticed, hey, the skin around the eye, ooh, it looks so smooth. What is this stuff? And they did further research, and that's when they went on to, well, we'll get to that in a moment. So, as stated, these are the original doctors that basically came up with our favorite toxin. Yes, it is a toxin. All right. So, now after the Carruthers discovered what they discovered, that's when, of course, it started to be sold for aesthetic usages. Now, we call it Botox. Hey guys, hey, welcome, welcome, welcome. Hey, how's it going? Oh man, we got you. First of all, you're already handsome. As it look, somebody pretty want to know how to stay even prettier. What am I gonna do with you? All right, so now now check this out. Now, because this is my area, you guys want me to tell you how much this is my area? Let me show you. This is how I get out when we start talking about the toxins and the aesthetics. All right, because when my patients are in a clinic, sorry about that, I like to show them why we're doing what we're doing and what is actually happening, as opposed to just injecting them, taking their money, sending them out the door, and they really don't understand really the mechanism behind what is truly going on. So after all the drug reps and everyone found out that the Carruthers had this amazing drug that made the skin around the eye smooth, I'm being careful with my words, they actually decided to go ahead and purchase the rights of use from that company. Now, we call it Botox, but calling Botox is almost like calling a tissue a Kleenex. That's a name brand, right? It's not necessarily Botox, it's botulinum toxin. And there are multiple people who market botulinum toxin, and it's mainly distinguished by the difference of the initial at the end, like botulinum toxin A, botulinum toxin B, botulinum toxin C. Allergan owns Botox, and they just happen to be the strongest marketer, just like tissue Kleenex. Kleenex is a name brand. Some of the other brands that are on the market are Dysport. You guys probably can't see that, and I know you can't. So yeah, but Dysport is another. Wait, let's see. Let's see. Is that? Okay. Well, anywho, I'll put a picture of it in the bottom. But Dysport is another brand of botulinum toxin, and this one is this was like this is botulinum toxin A, and this is owned by Galderma, and another company, Mertz, has their version of botulinum toxin, and it's called Xeomin. And this is, like I said, this is owned by Merch. They all do the same thing: paralyze the muscle, period. All right. It's just some of them just, as a matter of fact, honestly, I prefer Xeomin. I It's less expensive, lasts just as long, and that's why I prefer. I like the fact that you can keep it at room temperature, whereas Botox, you always have to keep it at a certain degree temperature in the fridge. And this port, this port is kind of like leading the pack right about now. More people are talking about this port. So just keep in mind when you go in and say, "I want Botox," I got a funny feeling. I'm just telling you right now. I have a funny feeling you're not getting Botox. You know what? Here, let me tell you why. It's the most expensive. I think that, okay, let me just go. I don't know anyone who wants to hear this nitty gritty part, but that's where we finna go. Do you know that a little bottle of this, as far as Botox, costs the provider approximately $650? Now, you guys go in and you want, I think like maybe 40 units or 50 units or something like that, right? They pull it up in a syringe, okay? This is not 100% this, because it would all be gone on you. All right. It has been reconstituted with this. All right. Now, there are some places that this is pretty much all you get, and maybe a drippity drip, because when they reconstitute, they fill it to the rim. And but then you go back and like, oh, why didn't my Botox last? Oh, you must have a fast metabolism, or they'll tell you something, right? If you got it at a reduced rate, get what you pay for. I'm just saying. So what we used to have in my office was, we called it an open bottle session, where I literally would take the lid off right in front of the customer, so that they could see that they were definitely definitively getting Botox, even if they were a Groupon patient. I didn't care. I treated everyone the same. Groupon to somebody who's coming in with a titanium American Express. You're still my customer. You're still going to be treated VIP. So I'm just stating that um, you may be getting Botox, you may not, but you are getting a botulinum toxin that is paralyzing the muscle, giving you the results that you want. That's a little information. You welcome. Not sure if you guys pretty much knew that. Hey Jacob, let me see what you're talking about. But my friend, okay. Okay, that's a very good. That's okay. So basically, he had a question. He's talking about his friend had pain secondary to a bulging disc, and he went in to the pain management doctor, and the pain management doctor said, "Oh, let's go ahead and do an epidural injection. Let's go ahead and let's take care of that pain for you." All right. So he injected the pain management doctor likely injected 40 milligrams of Kenalog, and he already had, Jacob, lidocaine mixed in. The lidocaine, a lot of times, is what gives you the immediate relief of the pain, because the steroid does not kick in for about a day and a half or maybe even two. Another thing that could cause the steroid to not kick in at all is if it is injected in the wrong place. But I'm quite sure that they used a fluoroscopy. If they didn't use a fluoroscopy, there's a very good possibility that it was injected into the wrong place. The other thing is, once you go in for the Kenalog corticosteroid injections, after a certain period of time, they stop working as effectively as they did in the beginning. Like usually after your first injection, you get pain relief for about 8 months. And what's so funny is when you go in, the average pain management doctor will say, okay, you got your pain relief for about 2 weeks to 8 months. That's like two football fields. So they'll give you like this broad window. And as you keep going back more often, it begins to become less and less effective. So I'm quite sure that doctor already included lidocaine in the first injection. And a bulging disc is kind of like I call it like hamburger meat pushing out from the two buns. It does not necessarily ever just decide to go back in, right? It possibly gets worse. I'm not necessarily sure how much your friend weighs. One of the things that we could primarily do to initiate contributing for some of the resolve of that is weight loss, and we could definitely go into that. So yeah, but I'm quite sure either the medication did not go into the right spot. Yeah, so last month, yeah. Oh yeah, because that's a very good question. So basically what is going on? Well, when you get that hamburger meat that's pushing out from the buns, um it's kind of like causing an inflammatory effect. And that's the reason why some of the natural products I use help with that, because all you're really trying to do is decrease the inflammation. Basically, in your vertebral column, you have your nerve, artery, and vein, and they're normally just like flowing through. And we call them the van. They just flow through. Let me see if I can pull up a picture. I'll help you out with that one, Jacob. Let me see if I can pull up a picture. So let's see. Okay, so if I okay, guys, bear with me on this now because I'm trying to be fancy, and I'm usually not this fancy. So I got this picture up. Let me see if I change this. Oh, cool, excellent. Okay, so let's see. So we'll change this to the I'll change it to a radiculopathy. Okay, here you go. Radiculopathy in the lumbar region. All right, and okay, so let's see. All right, well, I guess okay. Here's a good picture. Oh, I'm sorry. I clicked on my picture. So, cause see, I can see the same thing over here on this other screen. So I just don't know which one to click on. Yeah. Okay. All right. So you see how like in this picture right here, you see that red irritated part right there. So this is like the vertebral column, and this is the bulging disc. All right. Now you see this yellow thing. This is like facsimile to a nerve. So normally when our vertebral column is in its correct alignment, there's enough space in between for the nerves, arteries, and veins to just flow through, la 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 la, just like a nice little flow. However, when you get any kind of a compression and you have a bulging disc, that disc, as you see, is kind of pushing up against the nerve, and that's the reason why the pain is sporadic. Sometimes it hurts, sometimes it don't. Sometimes it hurts, sometimes it don't. So how do steroids help with this discomfort? It decreases the inflammation. The main reason that this area is so tight up in there is because it is inflamed. So once the steroids take effect, they decrease the inflammation, which decreases the pressure, which decreases the feelings of radiculopathy. Now, how can some natural things like even food? You remember last week, 2 weeks ago, see, that's why y'all got to pay attention to Dr. Test. I'm not just sitting over here rattling. You remember I talked about anti inflammatory diets. If you could keep the inflammatory effect of your body down, it's a lot of stuff that you could resolve. All right, what is ibuprofen, right? Anti-inflammatory. Almost everything that helps with some of the acute pain is a anti-inflammatory, right? So that's what the steroid does, but it wears off after a certain period of time. And why is it that it stops working after a certain period of time? Well, the disc is still bulging. We didn't stop the disc from, but we haven't fixed the problem. So basically it's kind of temporizing. It's and usually most pain medication doctors will tell you this is temporizing until we figure out permanent long-term resolution. And unfortunately with Americans being with our weight problem, one of the main ways of resolution is weight loss, because we could go into that topic maybe next time we talk. You know what, back pain was one of the things that's on our list, so I have no problem expanding upon this on our next video when we talk about back pain. But what is one of the main reasons why us Homo sapiens that walk erect have constant back pain and knee pain? Well, that goes with the point of us walking erect. It goes against um, it goes against a lot of our physiological gravity. And then once we pound on the extra pounds, your poor back. Oh my God. Can you think about it? You got this little skinny guy right here. Let's see. You got your poor little Mr. Vertebral column. Here's a better picture. You got poor little Mr. Vertebral column. He's just minding his own business. He hasn't hurt anyone. He just wants to exist. And here you come pounding on a tummy and hips and this, that. And it's just this skinny little guy. He still got to carry you all around. And after a while, it's going to start to hurt. It's going to start to cause pressure. It's going to start to cause compression. And some of the activities that we do at work, when we don't necessarily lift with our knees and we lift with our back, flexion, extension, hyperflexion, extension, secondary to what? Tech neck. there's, there's a whole lot of pathology that's on the brew secondary to just this. All right, so we could definitely go into detail with that on another topic, but I hope that that helped you out with your friend. uh, Absolutely, no problem, no problem, absolutely. All right, guys, so moving back to wrinkles. So now that we have it, and there was actually a time when Allergan, check this out. Let me let you guys in on the industry secret. Allergan and Mertz, it used to all be in the same big witch's brew. Xeomin and Botox used to be roommates. It was all the same. And then they split. And when they split into different companies, they had to figure out a way to differentiate the name of the same. Now, I'm not going to say they're the same exact thing, right? I mean, I'm sure there's a difference between Puffs and Kleenex, right? Or something that said they are exactly the same thing. But what I am saying is they close enough. So now, okay, now I want to share with you guys also an article that I was reading because it was talking about the new protocol for the use of botulinum toxin. Now, I'm sure there's probably a way to do that without the two step, but that's how I have figured it out. So that's what we're gonna ride with for right now. All right. Okay. Oh, uh-oh. Wait. All right. Now I just all right. Okay, now I did this totally 100% wrong, guys. I got too cocky. Let's see. Okay. I'm not sure which screen you guys just saw. I got a little wait, you know what? I know I can have this still here, and then um is that how I did it before? No. Okay, I'm all confused. You know what? I got so doggone cocky. I was so like proud of myself, and now I've gotten all confused. Okay, yeah, I'm totally 100% confused. Let me see. Okay. Now let me try this one more time. And then oh, I know. Okay. So then well, I won't be able to get to I had an article that was available, and now I don't know how to change the article. But let me just go ahead and keep the flow going. I just want to show you guys what the current way that they're doing the reconstitution of botulinum toxin. Maybe I could show you guys that. The article, I actually pulled it up just for you guys. Reconstitution of Botox. Okay. I pulled the article up just for you guys, but that's okay. I'm okay with that. So this is what I was sharing with you guys. This is close enough. So currently, one of the main ways that the botulinum toxin is being reconstituted is 2.5 units, um, as far as like the percentage of zero point 0.9 normal saline that is being added. So when this first comes, it's a little bitty film powder at the bottom of the glass. You could barely even see it. You're like, really? What is that? And the powder receives a certain amount of normal saline to reconstitute it. Now, according to the current literature, they were initially reconstituting to about 2.5 units per injection with the reconstitute. This is just me kind of like just trying to like say it in layman's terms as much as possible. Basically, the new trend is to decrease the amount of saline that is being added to the botulinum toxin to give longer lasting and better results. Now, the literature also mentioned it all depends on like what part of the face you're injecting. The injections, let me see, areas where Botox is injected. Okay, areas for Botox. So the areas that Botox is injected are quite vast. I It's a lot you could do with this. I mean, we actually call it like a a liquid facelift because that's basically what it is. Now I've just now this picture, guys. Let me tell you something. So now I have a whole different picture than the ones you guys. So I'll just refer to the picture you have. So there are just many, many, many different areas that the toxin can be injected. And what is the point? Why are you injecting this product into those areas? All you're simply trying to do is decrease the movement of the muscle. I'll show you that in a moment here. Okay. Okay. All right. Now I'm back on page again. So um the areas that are being the areas of the muscle that are moving are okay, I don't want to be here. All right. You know what? I'm gonna try to like stop getting fancy. Basically, I'm just going to show you guys one more thing. Then I'm beginning to like get over this whole thing about this whole screen sharing thing. I just really want to I just really want you guys to understand what you're getting when you're getting a product injected. Let's see. Uh, okay. Let me see. Uh, Muscles. Okay. All right. Here we go. So this is the picture that I shared in a So it's just gonna every time I do that, I do the wrong thing. Uh, okay. Okay. I'm the problem now because I shouldn't. So there's a way when I could click, but anywho, I'm going to stop because I'm the problem now. But basically, if you just notice, the Botox is stopping certain muscles from moving. let me just get to the point. And if the muscles are not moving, that decreases the probability of continued or increased wrinkles. Done and done. As we make certain expressions, we move certain muscles. For example, whenever we frown, we use the frontalis muscles. Whenever we smile, hey cheese, we use the ocularis muscles. Whenever we make certain expressions around our mouth, we use the muscles around our mouth. Whenever we like, if someone has like a gummy smile, that's because certain muscles are more so causing a lift of the upper lip, which means your gums show. So if you inject this person, the upper lip won't go up as high. So it's basically a antagonistic effect. So now, what are some other ways that we can stop having wrinkles from the movement of those muscles? That's the question we're asking. And the skin sheds like caterpillars, reptiles. The skin sheds constantly. It's constantly shedding. And what layer of the skin is it that is true? What, see, if we think about what is the concept, what is going on, why are we getting wrinkles? Why are we getting the wrinkles in the first place? Now, would it be that I'm horrible when it comes down to this screen sharing? I'm gonna use my book. Now, yeah, my book works. You may not hear me, but my book works. Okay, so one side of the face is young, one side of the face is old. Okay, they're the same person. How did this come to be? Now, when we're young, yeah, when we're young, our face more so has an upside down triangle where our skin is nice and narrow and up towards your temporal region and everything. That's where the base of the triangle is. So that's the reason why like Angelina Jolie is considered to have the most beautiful, well sculpted face because everything lifts up. All right. Now, as we age, some kind of way, the triangle flips. Now it's an upside down triangle. Now, see the bottom, all that part that used to be at the top, it's like it flipped. So this is not what we want, right? Now, why does that happen? Well, basically, you should have a congratulations because as we age, physiologically, things start to change. The fat pads that are in our face, they start to separate. Initially, when we're nice, young, and fluffy, the fat pads are all nice and together. That's on this side. And then as we age, they separate. All right. And that's why some people get like that hollow with the bulging under their eye. That's not really a bulging, but it's what appears to be. The muscles in our face start to separate. And as you see, they cause everything to go downward. The bone in our face starts to atrophy. Congratulations! You live long enough to start falling apart. So, I mean, it's going to happen. It's going to happen. Also, what else is happening? Under all this, there's an extracellular matrix. In that extracellular matrix, there's water, there's hyaluronic acid, there's elastin, and it's all supposed to be like this matrix. Okay, what are some other things that are going to break down some of the content of that matrix? UVA, UVB, this blue light from the computer, uh, washing your face, exfoliation, time. So it uh, for our face to go through signs of aging, it is what it is. Now, we have come up with ways to restore some of all this stuff that normally was just decaying, and it just went away. Almost every product on the market, you show me one that doesn't say we got hyaluronic acid. Everything has hyaluronic acid, right? Now, let me let you in on the secret though. I'm just exposing all the secrets. The hyaluronic acid that's applied topically is about this effective. Hyaluronic acid is almost absolutely not effective if it's applied topically. Just think about it. It was able to hold your face together. Now we're gonna put it on top. What? Just gonna absorb. Now, but does that mean to not get topical products with hyaluronic acid? No, I didn't say that. But I just simply said that the hyaluronic acid and the collagen, we get a breakdown of collagen, and there are different types of collagen. So you can't just put any collagen inside of your body and expect it to kind of like provide you with that increased volume. So it's while the muscle is paralyzed with the botulinum toxin, that's when our homework kicks in. That's my point. That's more so what I'm trying to say. That we do have a role. We do have a dog in this fight. That's a saying, right? A dog in this fight. Yeah, yeah, that sounds good to me, right? So we do have something that we have to do. Um, um, what can Botox treat besides wrinkles? Is it? Oh my God! Yes, yes, yes. Oh Lord, yes, 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 yes. Well, if we look at how it originally came about, it wasn't even supposed to be treating wrinkles. That was an mistake. I mean, Botox is used for migraines. Um, I use it. It's used for sweating under your arms. It's actually used as a form of seizure medication. It's used for many, many, many neurological pathologies where you really need the muscle to stop triggering so fastly. I think it's even used in like um, I want to say muscular dystrophy, but there are a host of uses. Let's see. Get my textbook out here. So this is the Carruthers book, and this mainly just talks about the ways that botulinum toxin is used for cosmetic reasons. But you know what? I will definitely get that additional information available for you. And I'm so glad that you asked about that. But in their book, they talk about some of the other muscles that it is used. Well, it's more so a cosmetic, but yeah, it's there are a host of you. So it's actually a favorable toxin. And if you want to, let me think, what is it? Like how they always say don't let children eat preserved fruit. That's basically because of the toxin that's similar to botulinum toxin that actually causes lockjaw. What does it do? It paralyzes the muscle, right? So it's just like if you look at it, coumadin. Coumadin is rat poison, but if we give in a appropriate dosage, it's the number one anticoagulant. Almost everyone who has any possibility of hypercoagulability is on Coumadin before we came out with all the fancy ones. But that's also the reason why you got to go into the Coumadin clinic and you got to make sure that you remain within the therapeutic level. Because if you are super therapeutic, it could start to play the role of a toxin. So that's pretty much the same thing with botulinum toxin. Within a certain discrete amount, yes, it's a fabulous product for aesthetics. However, if we use too much, remember, it is a toxin. All right. And I had a patient one time when I did one of my travel medicine assignments, and the person, I think, I'm not sure if it was because of, another thing that could cause that effect is IV drug use, the toxin effect. I should have looked that up for you guys, and I don't have that information available. But it actually caused this guy to have lockjaw, so we had to intubate him because he couldn't swallow, he couldn't breathe, and we had to wait for the toxin to but we called it a neurologist. It was. Yeah, I enjoyed that hospital. I did. That's one of the things I like about travel medicine. So, but anyway, yeah. So, absolutely, There are many, many, many uses for oh, another thing that I use it for a lot of times in my office, bruxism. Some of my previous videos, I think I actually talked about some of these different things. Um, at night, you go to the dentist and your dentist says, "Who removed your wisdom teeth?" You're like, "Nobody." You just grinded them down at night, and then you wake up in the morning with the severe headache because all night your mouth has been working. Botox works for that. You inject it into the masseter, and it also gives you a nice, slender look to your face. The TMJ, TMJ pain. As a matter of fact, botulinum toxin for those uses are normally covered by insurance, and that's what's actually kind of cool. So, because when you inject it for migraine headaches normally start at the frontal aspect of your head, and they usually travel along the temporal parietal region, and they go back to the occipital region. That's how a migraine headache travels. So when they inject Botox, they usually give you about 100 units, and it's usually 50 units per side, 50 units here, 50 units here. And when they inject it, they do inject it into your hairline. So it's like you get a resolution of your migraine and a nice little smooth forehead. And I think the insurance actually covers it every 3 months. So just imagine 100 units of Botox every 3 months covered by your insurance. Not too shabby. So yeah, it's definitely available. I had a patient and I used to inject her for aesthetic reasons, and I would inject her mom to treat a migraine. So it was actually kind of cool. Also for urinary incontinence. Because if you think about this, a spastic bladder, right? So if it's a muscle that is spazzing out, Botox will fix it. Just think about it. So absolutely, thank you very much. I hope I didn't go overboard, but yeah, I get all excited. I'm into this whole medicine game. So yeah, those are some of the other uses for it. Now, so we've talked about how is it that what does it do? What is the purpose of it? Where does it go? What does it fix? So are we saying, well, I don't want to need Botox, so I'm not gonna smile, I'm not gonna frown, I'm not gonna say stinky, stinky, I'm not gonna do any express. No, live your life, okay? Just think about it. Back in the day of Marilyn Monroe and all of the beauty queens, um, how did they keep a nice, beautiful, smooth face? They didn't have botulinum toxin, Dysport, Zev. They didn't have nada. All they had was themselves. I've showed you guys one time before. Let's go down the list of possible remedies. Number one, facial exercises. Well, number one is diet. Number one is diet. You could definitely preserve a lot of the youthful appearance to your skin with a healthy diet. That definitely goes without saying. Number two is decrease the exposure to the things that are causing the problems. Decrease your sun exposure. If you do go into the sun, make sure you wear your sunscreen. We all use the blue screen, but we could try to remove ourselves as much as possible, and just basically I think that I do really feel as if facials, exfoliation, and masks that you could do with things that you have in your kitchen cabinet can help just to maintain a natural purity of your skin. The facial exercises. One of the facial exercises that you could do, and I could just do it for you guys right now. Everybody, okay, we're all going to do it all together. One, two, three. We're all going to make these silly, silly, silly expressions all together. One of the let's see, did you have to take a class? Oh, I don't know. I don't my office I don't take issue, but I think, well, first of all, just expanding upon that, anybody, that's a very, you know what, Jacob, I'm glad that you brought that up. First of all, even though this seems like a simple procedure, it still is not without risk. What are some of the things that can go wrong? Well, you could inject someone and you could get a droop. And this cannot be reversed because basically this has gone into a receptor. And let me see. Okay, guys. Yep, I'm gonna try it again. Yep, I'm not gonna give up. I'm gonna try this. Okay. Now just think. Next week I'm gonna be real fancy with it because I'm actually gonna. Um, this week I was able to get the video up. Next week I'm going to be able to rock and roll with it. So I want to show you guys the receptor. I know I'm not going to click on anything on this side, and maybe I'll be working better. Botox. See if it'll show it to us. All right, cool. All right, so now this is one of the main reasons why some people say, "Well, this Botox it don't work for me. It don't work for me. I'm resistant." Mm, maybe you may not, you may be, and you may not be. But actually, what happens is once the toxin is injected, it actually binds into a receptor and it blocks that receptor from being able to fire or trigger, which basically that's how the muscle is allowed to stop moving. I think it's um is it acetylcysteine? Let me see. I'm not gonna quote because that was not the information I had prepared, but just understand that that's mainly okay. That's mainly what's going on right now. The receptor is being blocked by the toxin. Now, what are some ways that this could not work? Well, what the receptor isn't blocked. That's one way, right? And sometimes, even though a receptor is blocked, it can still fire. Sometimes the oh, it could stay blocked for a shorter period of time. Sometimes it can stay blocked for a longer period of time. So let's now we have these receptors all over our body. So if the toxin is injected, because we just talked about all the different muscles that we could paralyze by using it. If the toxin is injected into the muscle we don't desire and it binds to that receptor, what we gonna do to reverse that? Nothing. So it's gonna stay bound for a minimum of 4 to 6 months. So if you are not a skilled injector and you just going, because a lot of people they inject the skin at the point of the wrinkle. You're not trying to inject the wrinkle, you're trying to inject the muscle. All right. That's the reason why to this day I mark with a blue pen. So you inject a person and you injected them in the wrong place. Well, that muscle's paralyzed. Now they're gonna walk around looking like they got a Bell's palsy or something like that, and they're stuck like that until it wears off. So there are a lot of people who are probably doing this procedure. I would challenge you to just go ahead and check the credentials and make sure the person is certified and is trained in injectables. I was a platform trainer for years. So, yeah, I got my credentials to prove it, and I got my patients to prove it. Go check my reviews. So, but yes, that's a very good question. So, I would more so just speak more so towards it ain't necessarily a class. Like they just went to some room that was set up a weekend. When they left, they were a graduate. But um, are they trained and are they vetted? Have they done this procedure before? Have they done now? Everyone will have a complications. What we used to say in school is if you haven't had a complication, you just haven't seen enough patients. Because after so many times, something's gonna go wrong because people have inanimate anatomy. So it's like even though normally most people have this particular muscle located here, you're different. Okay. So anything could happen. And that's the reason why we get you decided consent. We would never hurt you on purpose, but if we do, we're sorry. All right, don't sue us. So that's pretty much the concept with that. I hope I answered that question for you. So now, like I said, if we use these muscles now, and as I showed you guys in that picture, over time, the muscles, the bands, they start to separate. It's just like any other muscle. If you don't work your biceps, what's going to happen? You're going to get flabby wings, right? So if you don't work the muscles in your face, what's going to happen? They're going to get flabby, right? That makes sense. So if they get flabby, then they're going to hang. Then there you go with that upside down triangle. So, what is one of the ways that we could stop the muscles from just getting flabby and hanging? Just like we do with every other muscle, we exercise them. So, there are neck exercise now, and also the the skin doesn't necessarily sag in the lower part of your face, all because of now the ice cream is falling off the cone. All right, it definitely is on its way down. But some of the like the chicken, the goblet neck, is not all just hanging skin. Your platysmal muscle. What are you doing? It's just sitting there. How many people go to the gym and be like, yeah, I got on the machine. I work my biceps. I work my hamstrings. I work my platysmal muscle. You don't do that. So this has to be an intentional, purposeful exercise that is incorporated in your daily nighttime regimen. How do we work our platysmal muscle? If we just do like little exercises where we're stretching it, that's causing a stretching of the muscle in this area. The platysmal muscle, as you know, trying to figure this out. So y'all better watch y'all, man. I'm gonna be good at this. Plat. Okay, so oh, there you go. See, the thing about the internet, once it figures you out, it figures you out. So the platysmal muscle is mainly the muscle that's down around the base of your neck. Now, we actually use Botox to relax these where it looks like it's strained, and it looks beautiful. It looks absolutely beautiful. So that's another way that the Botox you use. But we also could resolve this with laser. That was that was something I was thinking about. But we want to exercise the platysmal muscle just to make sure that we could keep that tight chin. Now, what are some of the exercises we could do around the mouth? I've showed you guys this before. Oh, you guys digging this? You having fun? You better hit that subscribe button, thumbs up, like. Better tell your friends. Hurry up, get them over here so we can all hang out. Okay. Now, any support you guys are giving to the channel is greatly appreciated because, guys, we are growing. Did you guys see that? We are growing organically, and it's just so rewarding for me to know that you guys appreciate the information I'm providing. So, thank you so much. I really appreciate you guys. So, no, but as far as muscles around our mouth, let's do it all together, gang. All right, everybody, come on, let's do it all together. So, some of the muscles we could do to help around some of the exercises we could do to help with the muscles around our mouth, the alphabet. All right, we'll do this all together. Okay. I'm going to look crazy on camera on purpose, but whatever. You guys are family. Okay. A-E-I-O-U. Did you see that? Because I ain't going to do it again. But basically, exaggerate those letters and you'll feel the muscles in that area like moving, stretching, waking up, being aware. There was another YouTube channel. I saw it as I was just, strolling that does facial yoga. So there's just like we exercise every other muscle of our body, just always be aware that you got a ton of muscles in your face. And if we exercise the muscles, that will help to decrease the laxity of the muscles. What were some of the other things that you guys saw that were decaying? Now the fat pads, it is what it is, right? I mean, now sometimes we would do like adipose injections where we do fat transfer. I don't know. It is what it is. Whatever. PRP is another thing because it's all natural, but the bone atrophy, we could try to help. How? Once again, with our diet. All right. Now, let's say we have a disease. Where, so if you have like osteoporosis, where you have a aggressive bone degeneration, what are some of the things that we do to decrease the bone degeneration? Calcium, vitamin D, right? So the vitamins, the essential minerals, these are different things that we could do on a dietary daily realm to help to decrease the bone loss and to help to strengthen the muscles in the face so that the sag isn't aggressive. Now, there are some, and also collagen. You guys saw me when I did a little Megan Needs video. I said, yes. I rest my case. I rest my case. Thank you so much, Mr. Hartley. That's what I'm telling you. Guys, listen, you know, keep in mind that before you run to the store for all of your answers, once upon a time, that store wasn't there, but the questions were still being answered. We're actually at the advantage because we could use the new school way, the injectables, and we could use the old school traditional way. And what you guys will see is there's not a topic that I'm going to have on this platform that's not going to include resolution of the problem, that doesn't include diet and exercise. I have, look, I had tears over the weekend. I did, because I was reading one part of my NASM, and it was, I was just like, oh my goodness. Exercise, in my opinion, should be up on the priority list of brushing your teeth. That's when I'm beginning to realize how important diet and exercise is. Almost all the medical problems we have are. There was one chapter that I read that talked about what happens with your muscles after sitting for 8 hours. Because the muscles are comfortable. The one that you're not using is like, hey, I'm cool like this. I like it like this. Don't use me. Don't you bother me. I won't bother you. And then when you move it, it gets annoyed. Think about some of the other muscles in your body that you haven't even moved because you haven't done an exercise. Focus on that muscle. So literally, if we and my whole thing is, how did something so important that could move the needle as far as die or not die become optional? Or if I have time, or my membership wore out, therefore I don't go to the gym anymore, therefore I don't exercise. I don't. So my plight, what's my goal? My goal is to get a healthy diet and a healthy exercise routine, second nature, but with you guys thinking it to be relevant. You can't do it because I told you to. Because as soon as I'm not looking, you'll stop doing it. It has to be to the point that it is ingrained, it is instilled in your DNA that this is just something that you have decided that you want to incorporate in your daily life. It has to be like peanut butter, jelly. Wake up, exercise. Go throughout the day, eat healthy. It has to become even. So that's my ultimate goal. But once again, I'm just sharing with you guys how facial exercises could help to decrease um, the wrinkles. Now, the product that I was using, there was a collagen repletion, and there are many foods that can help to restore collagen. Now they have cheaper. There's something that they have at Sephora. I'll leave the link in the bio. It's like $11, and actually, I did a video on it. It actually does the exact same thing as botulinum toxin. It actually, because I did a talk discussing the mechanism of action. Uh, the thing is that it stated the younger your skin is, the more effective, and the older you are, the less effective. So it's like duh. But now, what are some of the things that we can also do to make the botulinum toxin results not be as visible? Smoking. I had a patient one time, like, sitting up in my chair. Hey doc, my Botox wore off. And I'm sitting here looking at her smoking a cigarette. I was like, all right, Arthur. And that's the reason why I could no longer just do aesthetics anymore, guys. I just felt I felt like a hypocrite when I was just like, only doing aesthetics and only doing injectables and not talking to people about a healthy lifestyle and how they all come together. So, what is the main point of everything that we're saying? Um, oh, and one last thing. You know, when you see a little baby, the nice little cute fluffy, full of hyaluronic acid, honey, full of it. And as time goes on, it decreases. So that's pretty much where we are with that. Um, some of the components, well, and botulinum toxin does not have hyaluronic acid. The hyaluronic acid is in filler, and we can have a talk on filler if you guys want to. How can we continue to keep that rejuvenated, fluffy appearance? Well, I can't say without hyaluronic acid. I can say different techniques, but yeah, it's kind of like it is. It is what it is. If this glass is running out of water, and if I want to put some more water in the glass, or if I want this glass to look like there's more water in it, I got to fill it back up with water. I mean, there's no magic trick for that. Um, and certain sports and certain exercises do cause you to have a decrease of hyaluronic acid faster than other life activities. So we could talk about that at another time. But immediately speaking, no wrinkles, no Botox. There are ways of getting around the Botox. Natural skincare routines, AM, PM regimens, exfoliation of the dead skin, the top layer from your skin, exercises that can help to maintain the muscle, um, just the muscle activity um, of your face. Eat a diet that helps to decrease the bone atrophy of your face. Um, just what else did I add on? Oh, and avoid some of the things that we know to be pathogens that are just hitting us every single day. The environmental, the the sun, lights, and make sure we wear our sunscreen and our sun protector. So that's pretty much. Oh, because someone had asked me, I'm 20. Should I start getting both? That's what started this whole thing. I was like, no, you're 20. Let's work on some of these other rabbits that we have in our hat. And let's see how things go as you get older. Another woman put in my DM, well, I was told that the first time I needed an injection was when I was 35. So I'm waiting. I was like, no, don't just go into a salon. Well, today, my 35th birthday, I like to get 40 units of both. No, there is no date that the fit. Like I was sharing with my followers. I had a woman who came to me. She was in her 60s, and her face, because as a child she did not do certain expressions. She didn't frown. Like honestly, we all could get through life without frowning. I mean, what? Why do we have to walk around like this? None of us. I don't even know if I could. If I, because yeah, I got my Botox, so I don't even know. But if I did frown, why do we have to frown? I think it's pretty easy for us to go through life without frowning. So that should be a given, right? None of us will have an 11 because we'll just all stop frowning, right? But there are certain expressions that we could do that could decrease the probability of expression lines showing up as wrinkles. So that's that. So what else you guys want to talk about? Y'all having fun? For those people who are watching on the replay, you better press that like button, subscribe button, come on back. We do it like this all the time. And I think we're actually going to have to add a day because there are so many topics that are coming in now. I'm probably going to have to just give up my once every Monday at 6 p.m. I'll probably end up adding a day. We'll see how it goes. So, well, that's pretty much about it for me. I share with you guys what is botulinum toxin, Botox, Xeomin, Dysport. Do we really have to use it so soon? Are there other ways of preventing the wrinkles? And just overall, the value of a healthy diet and exercise. So, thank you so much for tuning in to Test MD TV. Let me check my co stars and see if anyone has anything on their agenda they want to talk about. All right, guys. Well, thank you so much, Mr. Hartley. Thank you so much for stopping by, Jacob. And thank you so much for stopping by. You guys are, man, you guys are just my backbone. I swear to God, if I just had you guys, that's worth it to me. Just, you guys have definitely um, made me to realize that no matter where I am, on what side of planet Earth we are, at 6 p.m. Pacific time, I'm going to be in front of this camera. So I'm Tess Washington, board certified physician and surgeon. Thank you so much for stopping by. If you have any comments, any concerns, if you don't like what I said, you think different, leave it in the comment. I'll answer you. And we're here each and every Monday at 6 p.m. And we will see you at our next broadcast. Take care.